They get plenty times we go dey complain, hey babe, this place dey scratch me, oh, hey, wahala dey for this side, peppery sensation and everything. Your girl go come dey tell you say sure say no be toilet infection. I know some dey get that kind of experience. Toilet infection and wetin we go learn for this video, and how to prevent and how to manage am. E dey important. And una welcome to Think Health with Dr. Neche. If na man you be, you come to watch this video, no tune off, because you get wife, you get pikin, and you get mama. Wetin come be toilet infection? Toilet infection na wetin people wey no be doctors dey call anything wey dey give them discomfort for their private area, their genital area. For the purpose of this video, we will call am V area. So anything like burning sensation, itching, foul smelling discharge. And people dey call am toilet infection because they think say na dirty toilet dey come catch am or come dey cause am. No. Doctors dey call am vulvovaginitis, meaning inflammation of the vulva and the vagina, mean something wey dey like wound around that area. And a very common condition, dey very common among women. And if you share women in total into 3 groups, one group, 1/3 of them, they get this problem in their lifetime. Wetin come dey cause toilet infection? We go know say toilet infection, as we take call am, fit dey non-infectious, meaning no be germs dey cause am, and e fit still be infectious, meaning na germs dey cause am. So before we start, we go come understand how our body take be. Everybody, both man and woman, get wetin they call normal flora or normal organisms or good organisms. So we go understand them, wey God don put for everywhere, for our hair, our eye, our ear, our nose, our skin, even the V area. Even men own too get them. Everybody gets these good soldiers, but they get certain things wey women too they do, wey dey expose us to toilet infection. So when we can't do those things, we can't kill and comot all the normal good soldiers wey dey there, the normal germs wey dey there. As we can't clear them comot, now wetin go come happen? The bad ones will come take over. They come dey form boss area for the side. They come dey cause wahala. That wahala wey we will come dey call toilet infection. I will understand now. So now we dey take, first of all, go find trouble, come comot the normal soldiers and expose ourselves to wahala. So things like hormonal changes, when we dey use plenty antibiotics, when we dey wash our vagina somehow, come dey clean your anus wrongly, or dey wear pants wey no dry, or reactions to things wey we dey use detergents, or even poor toilet habits, infections like fungal infections, candidiasis, and even sexually transmitted infections. So how we go take know say person get this vulvovaginitis? Wetin be the symptoms? This thing are the diagram of how our body, female genital reproductive area dey, and that arrow na the vagina show, wey dey connected to our womb and to the ovaries. So when person can't get wahala around this whole area, wey they call vulva, wey dey around our laps, it go come cause things like itchiness, fishy odor, and the rest of them. Some people go come complain of burning sensations. It is very common, or even scratch the whole area. They scratch them. So they, even for public, will do their legs somehow. Say they hold the itch, they too much, or even redness of the vulva, the skin around the place, and even blisters, where they like if hot water do them, or even bumps. And you can even complain of discharge. You know, some women they get normal discharge, we can't dey white, they become be like chalk for their hand, no even they get smell. Or some people go complain say they get yellow greenish discharge. Sometimes they'll say the place just smell like rotten fish. Or if they won't come do, they do. It be like say they get pain, they can't dey normal. So if you suspect any of these things, you dey get any of, or you know person will get them, wetin the person supposed to do? Wetin you supposed to do? So one of the things we supposed to do, importantly, we say we go hospital. Our people too they like may we go lab, may we go chemist, may they miss medicine for us. No, we go stop them. If you watch this video, they do those things, now your choice. Because when you go hospital, wetin be the advantage? Because I don't tell una say many of the causes no be infections, and sometimes it could be infection. So now when you go hospital or clinic, they go help you understand which one the cause am. They go come tell you the particular test wey you go do wey go help you know wetin dey cause am. They get some questions sef they go dey ask you, or they come check, they come help you find out wetin dey cause am, and if you know the cause, you go know the treatment. So no be to take our body do try your luck we go dey do. No, we go pay attention. Number one, clinic or hospital. Na shinkly money dey take open file there. Now when you can't go this hospital and you can't see doctor, you fit ask also if they get am. If for big hospitals they get am, like teaching hospitals and some private places, they get wetin they call gynecologist. This one na specialized doctor. No mind the BB grammar. Now doctors wey sabi everything wey concern women issues, wey concern the V area, wey concern the womb, everything. Now them they call gynecologist. You can't explain yourself because they deal with women matter. They understand us already. They understand us. So that way you go encourage your wife or your partner or your sister or your daughter to go see gynecologist. You go treat the area very, very well. Give you medicine wey go cure am. Tell you wetin you go do and wetin you no suppose do. That way you go benefit pass. You no wan meet person wey get training. Na kwak una wan go. Check am now. The third thing wey we go do if you get any of these symptoms, so you go see wetin they call venerologist. Venerologist na specialized doctor too. Doctors wey sabi anything wey concern sexually transmitted diseases. And for the whole world, venerologist most times na dermatologist too, meaning skin doctor. So they know about reactions. They know how to treat sexually transmitted disease. And they go help you, teach you when is a reaction, when na allergy, they go teach you. They go tell you wetin you go do, where you go make up, or wetin you go rub, where you go stop her. So you see, you benefit, you have options, good options. No come they do staphylococcus all the time. I don't lab, na staff they see. Na lie. Now your money they waste. Now your body they take do experiment. Or this person drink medicine, my drink and too. You work for this person, abo my try abo my rub abo. Now yourself you they finish you. Check them. Why? After this information, why you go call no one do wetin you supposed to do? Go to the clinic and get treated once and for all. So how you go take prevent and tips to prevent toilet infection? Number one, we go understand our area. Men get 2 openings, one for shit and one for piss and other things. But women get 3. The first one are for piss. The second one na where pikin they take come out and where would they do. Then that's for adults. And the last part now where she they take come out. So you see, for women if they too close, now you make, if we won't go toilet, if you go toilet finish, shit finish, you go come clean from front to back. Many of our women they clean from back to front. No, try to do front to back. That tissue, that thing where you hold front to back, that way you no go carry the germs way there for shit area can't go the V area. No, from today we supposed to front to back. You can't avoid douching. Douching now when people they wash the V area, see if no na cloth. They will put soap, they will put different things, say they wash and make the comment germs. Who tell you say the place they dirty? You don't wash your nose before or your ear. God has a way of tidying those places. The next thing, we can't avoid all these hygiene sprays, say feminine care, feminine sprays and powders. Sometimes we they get reactions from them. Sometimes when they put them inside, can't declare the good germs where they fight for us. Now we they cause wahala. Leave them as it take be. Just do the normal things. You can't wear cotton underwears. Cotton underwears they cool for body. If they allow breeze enter the place, if they help the skin they dry, which go prevent this whole wahala. You can't avoid damp underwear. No, they wear underwear when no dry very well. Maybe they for a place where you know fit dry your pants for outside. Buy a dozen. You say before one go you use another, you go can't dry. You can't stop the use of antibiotics. When we go for chemists, all these patent medicines or give me antibiotics, I get infection. You go can't clear that good part. Can't leave yourself. And if you can't do they do with your partner, make sure you say you urinate immediately after. No forget them. Immediately you finish, you urinate. You can't get good toilet habits. Sometimes we go forget say when we go outside, we wan come piss, the rush house come piss, no go even remember say you suppose wash your hand before you piss. You go wash your hand. Even sometimes you wan scratch the area, we go dey scratch and we forget say our hands no dey clean. That way you go introduce more germs, you go come cause more wahala for yourself. So which of all these prevention things wey I talk wey you no agree, you no agree, and why? Write am for the comment section wey dey down there. May I understand you. Meanwhile, may una like this video, may una share give una people, may una subscribe, put your button on for free. You no dey pay money for liking and for subscribe. May una enjoy you.